Hi, welcome to Working Smarter.
Working smarter.
Working smarter.
Working smarter.
I've been all around VillageMD.
From the fine city of Houston
to New Hampshire and everywhere in between.
I've seen the great work
our people are
doing. It's such an incredible,
Exciting,
fantastic time to be at VillageMD.
Hi, welcome to Working Smarter. I'm Wendy Rubis, VillageMD General Counsel. Such a pleasure to be kicking off our new Around the Village series. I'm here today with Dr. Robert Perlmuter. Hi, Dr. Perlmuter. How are you?
Wendy. Good. How are you?
Thank you so much for joining us. And we're here at the National Physician Meeting for VillageMD. So it's always such a great time to catch up with our doctors. Tell us a little bit about yourself for those listeners who may not know you.
Well, I've been in practice since 1988 in Lincoln Park, a nice area of Chicago. And my practice has grown over the years. And now we have 5 doctors and 1 nurse practitioner and 3 PAs. I'm on staff at 2 hospitals here in Chicago, Northwestern Memorial and St. Joseph Hospital.
How and why are you working with VillageMD?
I found VillageMD through one of my patients who I was explaining some of the challenges in medicine, and he had a friend, Tim Berry, who runs
so awesome.
VillageMD, and he said I should contact them.
That's so funny. Everyone knows Tim Berry. So what are the challenges? You mentioned you were talking about challenges. What are the challenges you're facing, and what would you say is one of the biggest challenges in the practice today?
That's a good question. The biggest challenge, I think we're having trouble understanding what in pay for performance and what we have to do to get the proper reimbursement for pay for performance. Yeah. I think that's one of our big challenges.
It's such a redesign, and things are so deeply entrenched in terms of how we've always done them. It's challenging everywhere.
I think mostly we've sort of ignored it until now.
Yeah. Well, that's what we do with change, is just hope it doesn't come, right? You've been practicing a long time. What keeps you motivated and what keeps you energized about doing this work?
I really prefer it sounds kind of cliche, but I just like the interaction with the patients, and the rest of it I could take or leave, really.
I think that's what we hear from so many of our physicians, that they just want more time to, as you said, be with the patients, help them, make the right decisions. So are you seeing fewer patients a day then?
Yes, I see far fewer patients. Although in our practice, we were never one of the practices that cranked it out. I mean, I probably saw the most patients, and I probably averaged 18 patients a day.
Yeah.
And my friends who are at different institutions tell me they see 25 and 30. Well, we've never done that. But, some of our providers are seeing 16 and 15 patients a day, but I'm probably seeing 6 patients a day.
Are you guys using a medical record, or what kind of technology have you introduced, and has it helped or made things harder?
Well, we first bought a medical, it was just an EMR, not a health record, but just the medical record in 1998.
Yeah, wow.
And then we switched in 2006 to a full electronic health record. And I would say in general, it's really helped because, people may forget, but the amount of staff time looking for charts when people called and trying to get results and leafing through the charts. So
it is easy to forget. It is easy to forget.
In general, I think it's been helpful, but as there have been more quality measures that we have to document, that's the big challenge. Is you're seeing a patient for an ankle sprain, and you got to remember to ask them if they smoke and document, and when was their last pap smear, and last mammogram, and their colonoscopy, and have they had their flu shot, and those things are tough to remember.
Yeah. How are you doing it? How are you trying to cue up those questions?
I don't think our EMR is great at prompts for that, so I just think
it's so hard. It's a challenge, no matter either way, because sometimes we give people checklists and things, and that's proving not to be as effective either, just because it doesn't reflect, the didactic nature of the encounter. So there's really no great way.
I mean, in the past, we get scorecards from our physician hospital organizations, and, I think that would incentivize my colleagues. We've always been pretty good at it. We've always got good grades on that, our practice. But I think then with VillageMD, I mean, they're really coming in and really helping us do these sorts of things.
Oh, that's so good to hear. So what would you say was an aha moment for you in your career?
The only aha moment I can think of in my career was when I was in training. And, I always thought I would be a primary care physician. But when I was in training, you would do all these specialty rotations. And the specialists would say, we'd like you to be an allergist or a gastroenterologist. I kind of think, well, that might be really neat. I mean, that might be a nice lifestyle, and the pay is good. And I think just one day I sat down and thought, I don't want to do all those things. I'd rather have a great breadth of knowledge rather than the depth of knowledge. And I really want to service a lot of different needs. And I would say that in my second or third year of residency was my aha moment.
I love that. Thank you for sharing that. What are you excited about? What are you seeing coming up, or what are you hoping for in the next, say, year or two?
Well, I just heard a lecture on utilizing a pharmacist in your office or a pharmacy tech, and so I'm excited about that right this moment, which I never realized the value that a pharmacist or a pharmacy tech could provide your practice in patient education and in compliance and checking formulary status of these medications. And I never thought about that. Instead, I have my medical assistant spending hours trying to get pre-approval, but we could skip that whole step. So right this second, I'm excited about, is there a way we can integrate a pharmacy tech or pharmacist into our office?
That's great. Who is a guest you would like to have us invite and hear on Working Smarter?
I've always sort of believed, I might lose some listeners here, I've always sort of believed that we have to cover everybody in America, and I've kind of leaned towards a Medicare for All type program. And, I can understand there's drawbacks, but I do think we need to aspire to getting everybody covered. And I know this organization called Physicians for a National Health Plan, and Quentin Young used to be the director.
Got it. Okay.
And he's deceased, so I don't think you can get him on the podcast.
Oh, that's going to be hard. I'm not putting it past our production team, but it will be hard from that.
You might find an old lecture by him. I'd love to hear what somebody from that organization would say, because I hear the point and counterpoints to national health insurance. I don't really believe in socialized medicine. I kind of believe in socialized insurance. I think there should be one insurer or a few insurers. It makes it much easier.
I get it. Yeah.
To practice.
Great. Well, thank you so much for joining us today. It's such a great chance to just meet you and talk with you, and we really appreciate it and hope you'll come back sometime.
Thank you.
Thank you to our sponsor, VillageMD. We hope you will join us for future concise compliance conversations.